story starts in 2015 when I started having nausea, like feeling nauseated. I thought it was something small, and I went to see the doctor. They even thought it was ulcers. I was given some medication, and then I went home, took the medicine, and I didn't feel any better. So they do more tests, and they find out that my kidneys have failed, and everything stops. You can't even think straight, because now when the doctor tells you this is for the rest of your life, at that moment in the room, in the hospital room, you can't imagine.
Well, advances in medical science have made it possible for an increase in successful transplantation of human organs and body tissues. Yet in many countries, Kenya included, there is a shortage of organ donors, which results to loss of life, and in many cases, it could be avoided.
It says that each person, after their death, they can donate their organs. And the responsibility is expressing your wishes to the healthcare provider who is looking after you at that time.
Your body organ could be used to save many other lives.
But I wasn't scared I would die. It was just understanding what I need to do so I can take care of my health.
Well, that was a recap from a previous episode on understanding organ donation, which you can find on our social media pages, Facebook and YouTube at CAC TV Kenya. Today, we look at organ transplant. Dr. David Martin Atue is a consultant physician from Uganda, currently based at the East Africa Kidney Institute. He has a special interest in transplantation. In fact, was part of a team that drafted the first ever Kenya kidney transplant guidelines. Okay, so Dr. Atue, let's first of all start by an overview of transplantation. What exactly is organ transplant?
Well, organ transplant is a process where we shift literally an organ from one place to another. Mm-hmm. It doesn't have to be from one person to another, because we know one of the commonest organ transplants we do is blood transfusion. Mm-hmm. And then the other one is skin grafting, where we get a patch of skin and put it somewhere. Mm-hmm. For people who have like severe burns and the like. So speaking generally about organ transplantation, it's just picking an organ from one place to another. For sometimes when we have to use another person's organ to give it to another one, then now we call that an allograft. So we are picking from one person to another. Say if it's a kidney, like in my case, or if it's a liver, or heart, or even lungs for that matter. Once in a while we transplant the top part of the eye, which covers the eyes, called the cornea. We transplant that, and for people who need it, so they're able to get it in case of need. So that would be the brief overview of organ transplantation and what it is. Just placing it from one place to another, or in our case, since we are talking about the others, from one person to another.
Yeah. You just mentioned liver, heart, and kidney.
Yeah.
Let's take Kenya as an example. Well, what transplantation of organ is more common? Let's talk of Kenya, maybe East Africa and Africa. The most common organ that is transplanted.
The most common organ, well, I must say there's a disclaimer, I am biased to the kidney. So not only does it make me happy, but I'm more biased that kind of information. So we see a lot of kidney transplantation between human beings. Then we do also have cardiac transplants within Africa. Within Kenya, we haven't seen much more than kidney, but there's been attempts at some hearts. And we know that in the near future, Kenyatta National Hospital will be starting to do liver transplants and the like.
And of course, for one to undergo transplantation, there must be a failure of that particular organ. So what could lead to an organ to fail?
Well, most of the things that lead organs to fail, it could be straight from something as simple as an infection. It could be straight from something as simple as trauma. So sometimes you could get, I'll give you an example, sometimes you could get so badly traumatized, physically, that you need to have a transplant done on you because you've lost both kidneys, or you've lost the liver, or your lungs have been damaged so badly during an inhalation or injury, and they have to give you another pair, or one for that matter. Since we've talked about the commonest being the kidney, I could just give a bit of information over there. Most of the causes of kidney failure we have seen due to long-standing illnesses which damage the kidney in the long run. So we have things like diabetes, things like long-standing hypertension which is not controlled, and you could have other things that come up that directly attack the kidney. There are diseases which you call glomerulonephritis. It's literally it's an inflammation of the kidney parameters which help you to pee, for that matter. We also have things that cause kidneys to fail in the short term. These people might not need transplantation, but we know that it increases their risk of having what we call chronic kidney disease. So these ones are who we call, they have acute kidney injury, and most of the times we have seen this in people who have lost a lot of volume. By volume I mean maybe someone is passing a lot of diarrhea, someone is vomiting a lot. So the kidneys kind of get a mini shutdown, and I will call that acute kidney injury. One of the more unfortunate people are the pregnant mothers who get severe hypertension, and this could also damage your kidneys in the short term. Luckily enough, in the long term, it might not be as much, but we know that anyone who gets any short-term injury might be at a risk for longer term injury. So when you look at chronic kidney failure, then of course now we go back to the other diseases we talked about: diabetes, hypertension. We've seen people with obesity, causing kidney disease, for that matter. We do see people who have primary, I call it primary because these diseases directly attack the kidney, and this could be long-standing kidney disease like focal segmental. We wouldn't want to go into most of those diseases, but some of the diseases of the kidney which directly attack the kidney itself can also cause long-term kidney derangement, and in the end, of course, kidney failure. And now these are the people who, of course, will need kidney transplantation in the long term as the better part of their management.
So in a previous episode, I featured organ donation.
Okay.
So what do you doctors consider before a transplant for the donor and for the recipient?
Well, that's a good question. And I'd like to start with the donor because he or she is the most important part of this particular triangle: the donor, the recipient, and the doctor. Right now in Kenya, we are doing living donation programs. That means the person has to decide on their own, without any pressures, social, economic, or otherwise. They decide on their own that they would like to donate a kidney. At this point, we only have directed donations. Say I'm donating to this particular person. You can't say I'm just giving up my kidney. Whoever will need it, will take it. Yeah. So it's still directed, and because it comes from a very altruistic point of view, this person is held in high regard, and we prefer definitely that the process does not worsen how they were before the process. It means that for the donor, you should have a maximum sense of well-being. Yourself should be healthy, and like the World Health Organization said, health is not only the absence of the disease. You don't have to only have the disease, but also the absence of the social well-being. Have to be doing well up on the brain, mental, socially, and the like. So we look out for healthy donors, preferably, and those who are willing to give their, in this part, for that matter, kidneys, to a related person. We prefer related because sometimes it's a very thin line between being altruistic and giving your organ to someone who you don't really know. Yeah, it brings up a lot of question marks here and there. So most of the times we want the donor to be healthy, so we go through a very, very rigorous screening for this donor, from things like blood pressure, checking your blood sugar, checking your weight and height to make sure you're the right BMI, because we've had and we've seen that, you know, if you have a high BMI and you want to be a donor, it's not good for you in the long run. Also, healing is a bit of a problem. So we try to, if you're not so fit, we try to make you fit, so that at least we feed into that altruistic self of that you're trying to reach out to. So you find us going through rigorous screening for the donors, and we are looking for diseases, depending on how old they are. We are making sure that they are preferably between 18 and maybe maximum 70, because the older you are, also the more issues you might get as you donate. So we try to make sure that you can handle the surgery, and also that after the surgery, you're not at a higher risk than any other person in the general population, because you've just lost one kidney. And we know this because God gave us 2 kidneys, not by mistake, but he was just saying, you have to survive with 2. But you can actually survive with 1 kidney without any really serious problems. For the one who needs a kidney or who needs an organ, whether it's a liver or a lung, we must be sure, first of all, that this organ has failed, and has not only failed short term, but has failed long term. In the kidney world, by long term, we mean something more than 3 months. So if your kidneys have shut down for more than 3 months, and you've been on any other type of, renal replacement therapy, whether it is dialysis, then yes, we know that you need transplantation. So we try to get you transplantation. We counsel you into how you can get it, where you can get it from, how it's done, the costs involved, where you can do it from, so that the person is fully mentally, economically, and spiritually ready to receive a transplant. Because it takes a lot of guts, not only for the donor, but also for the recipient. Because like I sometimes tell our patients, the kidney you have is not yours. Someone gave it to you. So it's up to you to take care of it. Yeah, take care of it as best as you can. Maybe even better than you are doing than the old ones. Yeah. So that's pretty much about that triangle of the donor and the recipient. So we want the donor to be very healthy, and also want the recipient to be sure that this is what they need, and we also want to be sure that this is what they need, and to take it on from there with the triangle moving on like that. Yeah.
So what is someone supposed to do once you learn you are an organ transplant candidate in terms of lifestyle? You just mentioned of health. Yeah. So what is one supposed to do?
Well, because we come from a background of the organ has failed, and by the time we are saying that you need a transplant, that organ has really failed. And because this organ has failed, depending on the functions of this organ, and I realize I'm trying not to talk about kidney too much, depending on the functions of this organ, depending on the diseases that you have that are already moving on with you, and depending on how you are doing already at the current state you're in, there's a lot of considerations on what you should do or how ready you should be for the transplantation. What can you do? I'll talk about the kidney once again. Most of the patients who need a new kidney, so to say, have a failing kidney. Now, if you look at the different functions of the kidney, managing your urine, managing your blood pressure, the kidney helps you to manage the levels of blood that you have. It helps you to manage the levels of acid and base that you have in your body. It helps you to manage, I talked about the P already. So it means that we tell you to try to live a healthy life. Now, depending on which functions are more affected, sometimes the functions which are more affected is most times the level of blood that you have, the amount of water that you can hold as a person, and then the blood pressure. Once in a while, you might get problems of bones. So now, if you take this now to the liver side, most people who have a failing liver have a huge accumulation of toxins. And these make your eyes yellow, make your body itch, and the like. By the time you need the liver, most of these toxins are also accumulating. So we tell you to try to avoid foods that bring about these toxins. Try to avoid foods that will raise your blood pressures, like salt, and then you try to live a lifestyle that gives you more blood. In the case of if you have less blood, so these people tell them drink more porridge, and have some fruits, have some greens, and then of course we give them drugs to help them raise their blood levels of blood. So I guess it really depends on how the patient is. It's never the same for every patient, depending on how they've come in, and if it's an acute phase for example, liver or lung, or a chronic phase still for liver or kidney, then we're able to advise you on how best you can live till you get your new kidney or liver.
So you've touched on the recovery for this particular recipient or donor. I'll take you back to the consideration.
Yes.
Does your blood group count for donation?
Yes, it does. In fact, it's one of the things we use to see if someone is compatible with another. It's just like donating blood. They'll tell you if your blood group, you can't give to this one, but you cannot receive from this particular one. Same thing goes for the kidney or any other organ. Preferably, they should be blood group matched in that sense. But we know that science has gone a bit further to allow someone with another blood group that is incompatible to give someone with a blood group that is incompatible. This takes a lot of rigorous preparations, rigorous drugs, and very heavy drugs, but it is possible in other parts of the world. Yes.
So you just touched on the recovery, and of course during the recovery there's medication. So what would you say are the side effects of this medication, and how do you counter?
It's a good question, because it's true, as much as we try to match an organ with a recipient, our bodies were never meant to receive something from somewhere else. So God put in place these particular soldiers and mechanisms to fight whatever comes that is not ours. So the body can recognize itself, but it can also recognize what is not itself. The moment it sees what is not itself, it will fight it. So the way we do it is we have to prepare you and give you drugs before the transplantation, and during the transplantation, and after the transplantation. These drugs are called immunosuppressants. So they try to tell your soldiers, relax a bit, we are giving you something that is not yours. Please don't fight it as much. We know now they still fight, but not as aggressively as they would have if it was just put in there without being on those drugs. And these drugs have improved with time. From the 1960s up to now, we now have better drugs because of the science that we know. Despite them being helpful, beneficial in preventing you from getting, this what we call a rejection, they have side effects. Yes, and indeed one of the commoner side effects is weight gain from the steroids. You could have these particular, because you're immunosuppressed, you might get infections at a higher rate than a person who is not on those particular drugs. Unfortunately, you might also get a higher chance of getting cancer as a side effect of these particular drugs. One of the other side effects you can get is diabetes from some of these drugs, so steroids and calcineurin inhibitors. So we prepare, and that's what I told you, that we prepare these recipients very rigorously so that they don't see this as something that has been sent to them, from, to fight, or something that has been sent to them from their past, Yeah, getting an organ is, you could actually say it's one of the beginning parts of the journey, because after that we have to make sure that you don't get these other side effects and the like. There are really more side effects you can get, but I bring this up because they're the ones which sometimes depress our patients the most, and they're the ones which actually depress us the most as well, because as much as nilikwambia, you might get, say for example, tuberculosis. When you get it, I still feel bad that that you've gotten it, and then as a patient they ask themselves, how come it's me who has the tuberculosis and not the other person? So we believe it has a huge psychological effect on them. And so that's why you don't see me talking about other effects that your blood can reduce, as some of the drugs we give you might reduce your soldiers' number and amount. But one of the effects, these effects that really affect the patients include, I've given you a new organ to help you live a better life, but now you have cancer as a result of the drugs and the process. So some of those are the side effects we see, and we say, we wish there could be something we could do about this. Hopefully, God willing, with time there will be something, and there's already something we can do, but they are really devastating side effects. Yeah.
Okay, so as you wind up, how do you stay healthy after a transplant?
See your doctor as often as you can. Normally I tell you every month, or depending on how it is. Know thyself. Because the person that you were before receiving the transplant and the one that you are now, you could say two different people. The quality of life has changed. You feel better. And we hope that this does not take you now back to how you are, to cause a failure, you see. Because I'll give you some examples. Say, for example, someone feels good and starts smoking again, or starts to drink alcohol over again, or starts not to take their drugs because now they feel good. That's not a good thing. So when I say know yourself, know how you are, know where you've come from, and know what your role is in this particular process. Your role is to keep healthy. How do you keep healthy? Take your meds, of course, because without those meds you lose your organ. If you have anything that you do not understand, ask your transplant coordinator, ask your doctor. Sometimes we don't really encourage them to ask themselves or Google, because some answers might be a bit, might not be as good as you might think. In the part of the kidney, we say eat well. So eating healthy fruits and vegetables and the like, depending on how you are, keep your blood pressure towards normal or normal. If you have diabetes, keep it nice and leveled. Depending on any other particular issue that you might have, there's a package that we give you as we discharge you and as we see you every other month. We tell you now you're better, you can do this. Now you're better, you can do this. Exercise is good for all of us. I need exercise, you need exercise, so those people as well need exercise, because it keeps us re-energized, keeps us revitalized and feeling healthy, so to say. It's pretty much, most of the times you want to really personalize and eat healthy and be better message to a person. But those are some of the bigger brackets we look at. Yes.
Thank you. Any last word to our audience?
Organ transplantation is a lifesaver. Organ transplantation has changed lives of many of our patients. At the same time, they do have challenges. Us as Kenya Renal Association have always pushed for this challenge. In particular, they have of insurance not covering their drugs after transplantation and their care, which you feel is like, you've brought someone this far and then you've let go. It's something that we are working on, and my senior colleagues and administrators are working on, and we hope for the best. We insist that instead of waiting for transplant, of course, prevent it. Prevent getting kidney failure. If you can prevent getting liver failure, the better. Uhuru has opened bars, but I prefer that people don't drink as much. Livers get damaged from alcohol. Get to know the risk factors from the health talks that we give, so that you can see how risky you're living, and then decide if you're very high risk or not high risk. Yeah, and live a good life.
Thank you so much, Santi.
It's been a pleasure.
Thank you.
Yeah.
Well, it is said that prevention is better than cure, and to avoid any of your organs from failing, check your lifestyle, be healthy, and stay healthy. That is all we had for you from this episode. My name is Aida Munzatsi, and as always, your health matters.